So welcome to this new meeting. In the previous meeting, we have just discussed about guiding symptom, keynote symptom, characteristic symptom, and we were discussing the merit and demerit of this terminology. And the merit of this term is all these are direct symptoms directly given by the prover. So they are more important. It is not like all the previous terminologies. Most of the previous terminologies we have seen, they are indirect understanding, or they are been understand and interpreted information. So as compared to that, these symptoms are more reliable and they have more value. And the demerit of this terminology is that one should not trap ourselves in the fallacy of majority. Now, what is this fallacy of majority? Now we have understood that these are grading symptoms, characteristic symptoms are based upon the statistical analysis of the majority. How many provers have felt this symptom? It is just a number game, and this number game is always not true. It is only sometimes true. The real characteristic symptom may be hidden into a very rare symptom which has occurred in only the 10 provers. So we should also develop the habit of referring to the pure materia medica. And regarding this keynote symptom or characteristic symptom, one more important aspect is so many authors are there who say that thirstlessness is the most important symptom of pulsatilla. Somebody will say the weeping is more characteristic than that of thirstlessness, and if weeping is present, you should give it to the patient. That is that much important. That if a patient is not weeping and then you are giving pulsatilla, oh, it is highly contraindicated. Somebody will say that no, weeping is very rarely seen in a male patient, and if you go by this weeping characteristic of pulsatilla, and we know usually Indian males or any males do not usually weep. They feel inferior to express their emotions through weeping. So you will never able to prescribe pulsatilla in a male. So for them, they say that the one-sided complaint of pulsatilla is a keynote. One-sided complaint means perspiration is only on the one side of body. The pain is felt on one side of body. So this differences of opinion will be there, and this differences of opinion will always confuse us. So we will have to aware about all these different opinions, different prejudices of various authors, and we should overcome this demerit of this terminologies. Is it difficult in understanding merit, demerit? शुभांगी कळतंय का? कळलं का? काही अडचण वाटते? काही प्रॉब्लेम, एनी डिफिकल्टी?
सर फैलेसी ऑफ मेजॉरिटी.
अब फैलेसी ऑफ मेजॉरिटी ना, इसका मतलब ये होता है कि जो सब लोगों को अच्छा लगता है ना, वो इतना इम्पोर्टेंट नहीं भी हो सकता है ना. कभी कभी होता है ना ऐसा कि we have seen how the characteristic symptom is evolved. Out of 100 provers, 75 provers have shown this symptom. Okay, then made it that symptom characteristic of that remedy. It is just because of majority, 75 crore out of 100. And there may be 25 crores who have shown some very hatke symptom or some very less
Rare
symptom,
symptoms.
like only one side of tongue is coated, one side of tongue. So tongue has usually two sides. It's divided by central axis, right side of tongue and left side of tongue. And only 15 crores will say that there you can observe that tongue is only coated on one side. It is not seen in 75 crores, so it is usually neglected, but actually it might become a characteristic symptom in some of the brewer, in some of the patients. So that is that fallacy of majority.
Okay, sir.
Then we will also see few more terminologies. Just now I have introduced you these two terms, particular symptoms and general symptoms. We will focus on this particular symptom and general symptom. These particular symptoms and general symptoms and clinical symptoms, which are very basic terminologies. One should never forget the meaning of this term. Now, before going to this understanding of this symptom, we will first understand why the need of such terminologies was basically felt. Now, to find out the answer, we will have to go back to the history of materia medica, and we will have to study how the various methods of study of homeopathic materia medica was evolved. So initially, materia medica was just a compilation of the brewer's symptom, and then when they started studying this compilation, they found that all the symptoms are not useful. Everything is not that much important. Something is useful, some symptoms are not useful. And in order to study homeopathic materia medica, one must remember the useful symptoms. So that type of study method has evolved. Then later on, they they felt the need. Okay, just this categorization of useful symptoms, not useful symptom is not important. It must be further analyzed into which is more useful, which is moderate useful, and then less useful. And then the need of these various terminologies were felt. Is it clear why the need of such terms were basically required? So, in guiding symptom, in characteristic symptom, yes, it was only two categories: useful, not useful, very important, and not important. But uh, further need was also felt to categorize this useful into more useful, into moderately useful symptoms and less useful symptoms. So that means what? The need of this terminologies was required for further preparation of merit of symptoms. So if 100 symptoms are there in a remedy and all 100 symptoms are guiding symptoms, still there is a confusion. Now the need required that out of this 100, which are first stage, which are 11, which is 21st symptom, which is 51 symptom, and again the need was felt to categorize the symptoms into more, that is very important, VVIP, then only VVIMP, and then only very important. So to categorize this again, the useful symptoms or important symptoms into more, moderate, and less, the need of this terminology was basically felt. And yes, these words, these dictionary meanings of these words, you should never forget throughout your whole life if you want to become a homeopathic student. And the dictionary meaning of general is, there are two meanings of the general in the dictionary. One is not special or specialized and common to many one. So using or wearing clothes is common to many, isn't it? But there are only few persons who will feel that there is no need of wearing clothes. So that is which is common to many is one meaning of general. And one more meaning is it is not special or specialized. That means all are homeopathic graduate. All are students of homeopathy. But then some special, there is no speciality in this meaning in this sentence. All are homeopathic students. So the meaning of general is there are two main confusing meaning of this terminology of general. One is a common to many, one is a not special or not specialized, and another aspect is it is relating to whole and relating to the whole and not relating to the whole. Sorry, it is relating to the whole and the thing which is not local. Ikram, any confusion? So this word general meaning has both meaning. It is also
Yes.
indicating common and it is also indicating the term which is applicable to the whole body, which is not local. So remember this. And in most of the time in homeopathic mater medica, and the first meaning is more important. It is relating to the whole body. It is not relating to a specific part. Is it clear? General symptom, whenever it is used in the homeopathic mater medica, it means it is a symptom related to the whole body, and this symptom is not related to a particular part. And then second one is the meaning of particular. Particular means it is relating to specific person or thing, distinctive, special, and individual fact or detail. But in which sense we use this term in the homeopathic mater medica is opposite to general. Opposite to general is what? It is not related to the whole. It is related to the local part. It is related to the specific part. So general symptom is these are the symptoms which are related with whole body, which are representing the whole body, and particular symptoms are the symptoms which relates to the specific part of the body. And again, I will recall that sentence, that one word of caution about the guiding symptom. It is not necessary that these guiding symptoms are always general symptom. Always general symptom means guiding symptoms need not to be always represent in the whole body. It might be sometimes particular symptom. Can you understand the meaning of that caution I have given in the guiding symptom? Ikra.
Yes, sir.
So guiding symptom can belong to any of this. It can be general symptom and it can be particular symptom. And then one more terminology is clinical symptom. So clinical is an adjective and the dictionary meaning is it is a relating to clinic or typical of a clinic. It is involving direct observation of a patient. It is a one more meaning is scientifically detached and dispassion. That means there is no emotions in that particular thing. Emotions means हाँ मैंने हमेशा देता हूँ मैं पल्सेटिला, फ्रस्ट्रेशनेस से दे दो पल्सेटिला, काम हो जाता है, बाकी कुछ दूसरा तीसरा देखने की कोई जरूरत नहीं है, ना उसके टोटलिटी देखो ना उसका और कुछ कैरेक्टरिस्टिक सिम्टम देखो. पेशेंट ने बोल दिया थर्स्टलेस, मेरा इमोशन से मेरी मर्जी, मैंने पल्सेटिला दे दिया. So that is an attachment with that symptom thirstlessness and prescription of pulsatilla. So the clinical meaning is scientifically detached and dispassionate. And then we will continue with this terminologies tomorrow morning. What is general symptom? What is particular symptom? and what is clinical symptoms. For the time being, we will stop here, but don't confuse between this double meaning of general. In homeopathic materia medica, it is used only related with whole body, the symptoms which depicts the person as a